This is the heartbeat of human services, a peek into the inspiring stories of our community and all things DHS. Join us.
Hey everybody, I'm your host Janice Slagle of the podcast The Heartbeat of Human Services. And today our guest is Yadira Vargas from the Kern County Network for Children. Welcome.
Hello. Thank you for having me today.
Yeah, thank you. So it's been fun working with you. We're really going to talk today about April being Child Abuse Prevention Month. And so you and I have been able to work together a little bit. Yes. I love the collaboration. We're always so much more effective when we work together, don't you think?
Yes, I agree. I mean, just working with the Department of Human Services has been wonderful because I feel like, it helps spread the word and share that, child abuse services should definitely be out in our community.
Absolutely.
We want that prevention to be shared.
We want the prevention, yes. And so I love that our county's doing a lot more in the prevention area. Mm-hmm. We've always been very involved, but now there's some new initiatives happening. And so you and I were talking before we started that I know you're fairly new to the Network for Children, right?
Yes. So I've only been there shortly,
3 months,
only a few months.
Okay.
Yeah.
But you have quite a background. So you came from working in the differential response area, right?
Correct. So I was a differential response supervisor for the Metro area, which I oversaw the South Kern, the West Kern, and part of Metro, which it extended from Taft to Fraser Park and just throughout the Bakersfield area. Prior to that, I was a differential response family advocate lead for the North Kern area, which that was overseeing the Delano, McFarland, Shafter, Wasco.
That's a large
division.
Area.
Definitely. When we think about it, Kern County is definitely bigger than we imagine.
Yeah, I talk to people and say, did you know we're the third largest county in California in terms of size of the county itself? Not the population, but the actual geographical space. So that's pretty big.
Yes, and
spread out.
It's really good to have programs such as, differential response, social workers working together to bring services to these families.
So can you tell our listeners a little bit about what is differential response?
So differential response is a program that collaborates really well with the Department of Human Service social workers. So we receive referrals from DHS, and these referrals basically come in different path categories depending on the risk level of the family. So that, of course, is determined by the social worker. And we work very closely with the social worker to try to connect the families to services. So whenever a family is reported to Department of Human Services, the social worker does their investigation, and after their investigation, if they find that the children are fit to still be, with a parent and just need those additional services to try to be stable and self-sufficient, then they send the referral to differential response.
Okay.
So when we receive the referrals at the differential response agencies throughout Kern, we reach out to the family, and then it is a voluntary program, so we do offer services to the families based on them being open to accepting the service.
What are so let's say we have a family living in Taft.
Correct.
And someone calls our department and they don't necessarily need our social workers, but they call the differential response or the social worker refers it. Does the family have to come into the office, or do you call them, or how does that work?
So initially, when it is connected with the social worker will do their investigation, and then our case manager will go out with a social worker, or may just receive a referral with a list of information as to what the social worker recommends the family gets assisted with.
Okay.
Like if the family is lacking proper bedding for the children, or the family is unaware of food resources throughout the community, or they need a connection to parenting classes. Our case managers will go out, meet with the family, and create a care plan, which will help the family determine what goals they want to set during case management.
Okay, so the family has input into what their needs are, and you guys know what the resources are in the area, and you connect them up. That's awesome. So are the differential response areas connected with the family resource centers?
We collaborate really well with the resource centers. Some are resource centers. We do have differential response case managers within different resource centers. However, some are agencies all of their own.
Okay.
So we do still refer quite a few families to the family resource centers throughout the community.
So anyone that wanted to have differential response services, that really comes through the social worker to connect, right?
Correct.
Okay. All right.
So first they must have a referral in place. So the social worker will first send it over to differential response. It has to first go through CPS before differential response can take action. However, if let's say the family was offered service at some point in time and the family decided to decline, but a few weeks or months or even years down the line, they decide to accept differential response services, or they feel like maybe having a case manager in their life will definitely help them at that point in time, they can always reach back to differential response and reopen the case.
Oh, that's good. That's great to know.
I'm your co-host Allison, and I'm interrupting today's podcast to highlight a special opportunity on behalf of our Job Fest team. Job Fest Lake Isabella is happening on April 20th from 10 a.m. to 1 p.m. For more information, head to jobfestkern.com. If you'd like to join our team here at DHS, head to kerncounty.com under the Careers tab. Thank you for listening, and now back to the podcast.
So differential response is one of the areas that helps in prevention, right? By kind of strengthening families and connecting them to resources.
Yes, definitely. We try to encourage the families to go by the by protective factors. You know, we want to make sure that they have those social connections, they're knowledgeable about the resources throughout the community, that they're aware of their child's development. So our case managers help with bringing into light those protective factors when working with those families.
That's great. And so you have those 5 protective factors memorized. Are they listed on your website anywhere, or?
Yes.
Okay.
So if you go to the Kern County Network for Children website, you'll find a lot of great information about the differential response program. Like you mentioned, you know, how do we collaborate with the family resource centers? I mean, we have great information as well on our website regarding the family resource centers. We also host collaborative meetings, and we support the different collaborative meetings that take place here in Kern County. So a lot of that great information is on our website.
I know. I saw that you guys updated the collaborative, or the FRC, which is Family Resource Center list. Mm-hmm. So the website is kcnc.org. I think. Is that right?
Correct.
Okay.
Yes.
And so there's a lot of really good information on there. And during Child Abuse Prevention Month, we have created some flyers collaboratively that we will be sharing around town that have information that can connect people to these family resource centers, because there's, I think I counted 15 of them. I'm not exactly remembering the number, but there's a good amount spread throughout the county. So hopefully if someone's listening and they want to find one near them, they can check that out on your website, and we'll link that too on our page. But so some of the other things we're doing together during Child Abuse Prevention Month, you guys have found a really amazing speaker for a virtual training that you're having, right?
Yes, and Dr. Jessica Price, she's a research professor from the Florida University, and she is bringing an abundance of information regarding diversity, equity, and inclusion within the child welfare system. I mean, she's a renowned speaker throughout the U.S., and she's done amazing job promoting child abuse prevention and bringing awareness to how we can bring diversity to the child welfare.
Good. I know that's an area that we've been aware of for a little while, the maybe inequities that need to be looked at. So it's really good that you're focusing on that and bringing a speaker like that. And I know it's on our calendar, but it is. Do you remember the date of that she's doing the virtual training?
So it will be Thursday, April 20th. Awesome. At 8:30 a.m. The Zoom link, it will be virtually, so the Zoom link will be accessible on the website.
On the website, and we're linking that too. So that sounds like a really interesting training for anybody out there who would like to learn more. And then our department is also hosting a training called Domestic Violence and Mandated Reporter Training, and that's also virtual. That's going to be that'll be on our website for the link for that. And I think Bonnie Holt, one of our social workers, is doing that training. So I think these kind of trainings help equip our community to understand, what do I do if I think a child is being abused, or even if a family, before they get to that place, maybe they're struggling and they just need some resources. This is the way to find it.
Yes, definitely. We want to bring as much information as we can to the community to bring that awareness. I mean, we want to have everyone on board. Absolutely. And doing their part. You know, if they see and they suspect that there may be a concern within a home, like, don't hesitate to make that call, because you may be saving that child's life.
Exactly. And you know, another thing too is we're really if you do call that hotline, which the number is 661-631-6011, there are trained staff to ask you questions and understand what's going on, but sometimes it isn't necessarily to the level of needing, you know, intervention, but a social worker can go out and talk to family and find out what the needs are and then connect them. So I think that's one thing our department is trying to help people understand, that calling the CPS hotline does not mean that a social worker is going to come to your home and take your children away. That is not necessarily the outcome. Now, of course, that could happen if a child was in immediate danger, but really the overall goal and is to strengthen families and make sure they're stable. So if somebody's struggling with like utility bills, which we see often, our utility bills are so high, they can connect them to HEAP or CAP-K services. So I think social workers really do know, and the people that work in differential response know all the resources, don't they? There's so many resources here. And so I think goal is connecting people to the right resources.
Yeah, and Department of Human Services website and the Kern County Network for Children website has an abundance of information that can also help. You know, if you feel that the family has is in need of a resource, not necessarily a form of abuse or neglect, but more of like, you know, connection to, like you mentioned, utility assistance or something within that sort, you can always go into the website and get more information.
Yeah. And, you know, just even letting people know you might qualify for CalFresh or Medi-Cal, or there's CalWorks opportunities, there's job help. So there's a lot of really great resources. So, some of the other things we're trying to do during the month we are putting posters in all of the libraries throughout town, kind of a new collaboration. We're equipping the different libraries with some fun craft items for the kids to make, and just letting people know that we need everybody to join forces to protect our children in Kern County. So was there anything else that the Network for Children is doing that you'd like to share?
Well, I just wanted to tag along with the flyers. We'll be also putting them at the family resource centers, because most of the content within the flyer is a list of the different family resource centers. Right. So if you happen to be in a different part of town and you come across a flyer and your family resource center is located in a different part, you know, you can always take that list with you once you screen the image.
The QR code. Yeah,
scan the QR code.
QR codes have become helpful a lot in the last few years, haven't they?
Oh, most definitely.
Yeah. So that's another thing we're doing. We are also collaborating with the County of Kern's administrative building, lighting that blue for the month, just to remind people about child abuse prevention. We're also doing something, Yadira, and you've probably heard about Blue Sunday. Have you heard about that?
Yes.
So, yeah, you were asking me for the churches and synagogues and other houses of worship, and we have sent an invitation to over 50 different places of worship to join with us in interceding on behalf of children who are abused. So we are sharing that information as well. So
that is great to hear. I know our faith-based communities do provide a lot of support when families are in need and they're not sure where to go. Sometimes the faith-based organizations are where they go and request that assistance. Right. And having that good collaboration with faith-based organizations is always very helpful.
It's important. I think you're right. People sometimes trust maybe their house of worship or their local clergy more maybe than they might a government agency. So that's a good partnership. We want to work together with anyone who's interested in joining us. And we're going to have a lot more helpful information on our website. So if anyone out there listening would like to learn more about how you can join us in Child Abuse Prevention Month, which is April, you can go to our website, kcdhs.org or kcnc.org. We are both sharing a lot of information about child abuse prevention. So thank you so much for being our guest today, Yadira. We appreciate you coming on.
Well, thank you for inviting me, and it was a pleasure.
I'm your co-host, Paola Hernandez, and welcome to today's Mindful Minute, where we will be talking about video gaming. So, I'm not super familiar with video gaming, but I know a lot of avid gamers, and that's why I think I'm going to pass today's Mindful Minute to Allison. Allison, tell us why you think video gaming is a good way of relaxing.
Well, that is an arguable point. I think many Call of Duty, Fortnite, and Overwatch players would disagree with you. However, there is a subgenre of video games called cozy gamers. And these cozy games are honestly one of the best ways to relax, plus a lot of times they're low-cost games. One of the best examples of this is Stardew Valley. If you've ever played a farming simulator, this is on a whole nother level. If you've ever played The Sims, anything like that where you can basically go at the game at your own pace.
I love those games.
Exactly. And in certain retirement homes around the country, they're actually introducing video gaming as a way to keep the brain healthy and strong. So there's a lot of benefits as long as you're not overdoing it. But when you come home at night, you can grab a glass of water, go to your PC, and play a cozy game.
Well, you heard it here first, folks. Video gaming is a great way to relax. So go ahead and try it out. I know I will, and this has been your Mindful Minute.
Thank you for joining us for the Heartbeat of Human Services podcast today. We hope you'll join us next time.